This is timely, so let's talk pneumonia. Pneumonia is an inflammation of lung tissue due to an infection, either bacterial or viral. It can be community acquired, just like a coronavirus or COVID-19. As a community acquired pneumonia, this means it's developed outside of our hospital setting. We also have a nosocomial pneumonia, which is acquired within the hospital. So this is a hospital-acquired pneumonia. Usually develops within a couple days after hospital admission, so you're an inpatient at the hospital, and then all of a sudden you develop pneumonia. Most of the time this is an aspiration pneumonia, but right now we're kind of under quarantine, and we're talking community acquired pneumonia. So our coronavirus, our COVID-19, has a community acquired viral pneumonia. We'll break our pneumonia out into a couple different types. So we've got typical, we've got atypical. All of these are caused by bacteria. So our typical pneumococcus, staphylococcus, our atypical, chlamydia, legionnaire, or legionella. So our typical pneumonias cause pretty severe symptoms. They're going to jump out at you. The patient's going to suffer pretty immensely. Our atypicals, these are our walking pneumonias, if you've ever heard that term. So our walking pneumonias, still caused by some bacteria, but they have very mild symptoms. When looking at chest x-rays, so all of your pneumonia patients are going to have a chest x-ray. We can have a lobar pneumonia, where it's isolated to a lobe, right? So we're looking at this, and we're looking at our definitions, our lung definitions here, along our kind of our lung lobes, and we can see like oh no, like right up here, we've got some issues right up here. So we should see pretty clear visions, pretty clear views of our lungs, but right up here, got this lobar pneumonia, and kind of affects just one lobe, maybe a couple lobes. But take an x-ray and it's like, oh, there it is, right? Compare that to a bronchial pneumonia. So we had this like, oh, there it is. And then now we've got this, well, we've still got some definition, but it's kind of diffuse. We've got some like diffuse infiltrate kind of all over the place. We've got a nice kind of definition of the heart here. We've kind of got a diffuse definition of the heart here. But we've got this kind of diffuse pneumonia. So we've got this bilateral thing going on here. Lobar pneumonia, we've got this really isolated issue going on right here. Then, apart from bacterial pneumonias, we also have this viral pneumonia. Again, now we're getting into coronavirus as COVID-19. This is a viral pneumonia, but outside these epidemics, outside of these pandemics, viral pneumonias make up about 50% of our pneumonia cases overall. Your viral pneumonias are going to be bilateral, whereas your bacterial pneumonias usually unilateral. Right here, we can take an x-ray and say there it is. Our viral pneumonias are usually going to be bilateral in nature, just a little bit more severe in symptomology than our bacterial pneumonias. Now, your patient presents you with some respiratory distress. What are you looking for when we might be thinking pneumonia? We're looking to rule in, rule out. So, definitely shortness of breath, just like all of our respiratory distress patients. You're going to listen to lung sounds. You're going to hear some junky sounds. So there definitely could be rhonchorous. Be a lot of rhonchi. It's not going to be fluid. It's not going to be wheezing. If the rhonchi gets worse enough, there might be some wheezing, but they're just going to be junky, right? So the lung sounds are just going to be junky, and then the giveaway here for our pneumonia patients is going to be fever. So there are a lot of really non-specific signs, symptoms of pneumonia. So cough, cough with sputum, maybe cough without sputum, maybe a dry cough, right? Some fatigue, maybe a high heart rate, low blood pressure, right? Some joint pain. They're really non-specific. Maybe some headaches, very non-specific. But if you see fever, you encounter fever, you hear really some junky lung sounds and some shortness of breath, we're definitely going to be thinking pneumonia. So what are we going to do for pneumonia? Well, most of our care is going to be supportive. We're going to support the symptoms. We're going to treat fever, give them Tylenol, right? Give them antipyretics. Let's treat the fever. Let's treat any potential hypovolemia. They've had a fever. They're coughing. They're breathing fast. So they're losing fluids. So let's give them some IV fluids. Let's give them some antipyretics. Try to drop that fever. If need be, we can give them some bronchodilators and try to open them up. But otherwise, in the pre-hospital setting, not a whole lot we can do with them in the hospital with their primary care physician, whoever they see. If it's a bacterial pneumonia, you can do antibiotics. If it's a viral pneumonia, we just kind of have to wait it out and support the symptoms. We're not going to know that in the field. We're not going to be able to test for bacterial versus viral in the field. So it's our treatment is largely supportive care. If you have any questions, comments, concerns, or cuss words, please let me know.